Hello, I'm Kevin Bernstein, Chair of Schoeneck King. The past 4 months have presented our communities with unimaginable challenges. Few among us could have anticipated that the year 2020 would have run the course it has thus far. A year of uncertainty, business downturn, and anxiety as a result of the COVID-19 pandemic. But now, hopefully, it can be a time for recalibration, emergence, and renewal. One thing is clear, we have all had to be resilient. Throughout it all, Bond has been there for you and with you. We've helped you make sense of guidance from the federal, state, and even local governments, and kept you up to speed with the ever-revolving door of new laws, rules, regulations, guidance, and executive orders. We counseled on how to keep your businesses viable and employees protected. Between early March and now, we wrote well over 100 client memos and presented more than 80 free webinars on every conceivable facet of the coronavirus pandemic and its impact on your business and operations. We also are the presenting sponsor of CNY Back in Business, an online news initiative designed to guide businesses in New York out of the shutdown. We were essential to your business as the world paused, and we're here for you now as it rolls back in motion. Please reach out to any member of the firm's COVID-19 Recovery for Business group or the bond attorney you may know best to help guide you through the next season and beyond. And most importantly, stay safe, stay healthy, and we wish you the best in your efforts to get back to serving your customers and communities.
Bond, essential to your business.
Good afternoon, everyone. My name is Kathy Purdy. I am the Marketing Manager at Schoeneck King. I'd like to welcome you to this week's Coronavirus Update webinar presentation. 2 quick housekeeping items before we get started. Please enter your questions through the Q&A box located at the bottom of the screen, and our presenters will do the best they can to get to those before the webinar ends. And once the webinar has completed, please take a moment to complete the brief survey. Our attorneys do look at those, and we greatly appreciate your input. So without further ado, I'm going to hand it over to Pete Jones in our Syracuse office.
Thank you, Kathy. Good afternoon, everyone. We've got a full agenda for today. We're going to lead off with Hermes Fernandez talking a little bit about some of the things that maybe we don't always focus on. Where are we with the developments, the treatments, the vaccines, projections, timelines, things of that nature. We're going to talk a little bit after that about employment litigation. We're going to talk generally about litigation risks. Give you an update on where we stand with unemployment, and then a little bit to cap off the afternoon on relief programs. So a very full agenda. And let's start with Hermes Fernandez in our Albany office, taking stock of where we are.
Thanks, Pete. We've faced a fire hose of new laws and new regulations since March 2nd as we've been trying to deal with this epidemic. One of the things I've tried to do through the course of the 6 months is actually keep track of where we are with the science and medicine. Not that I'm a doctor, not that I'm a scientist. I try to follow these things from a complete layman's perspective. But I think given the laws and regulations, all are in response to the pandemic, it's important for us to know, where we are and what the developments are. So I may be covering things that some of you have seen. I may be hopefully offering you some new information as well. But the context is important, and I think the time frame is important. We are literally more than 6 months into this now, and one of the questions, one of the great unknowns is how long will we remain in this situation, dealing with the crisis, dealing with the pandemic. So, you may have seen yesterday, you may have seen today. These last 2 days are a horrible marker. We've crossed the 200,000 dead in the United States from from COVID-19, and that's all since the end of February, beginning of March. That's an unbelievable number. I've seen it expressed in different ways, but it is just an extremely large number. Now, on a daily basis, things right now are going a little bit better. Depends on what source you look at, but Johns Hopkins University, or the famous Johns Hopkins Medical School, is one of the places that has been tracking these numbers. In the United States, we've got 52,000 new cases yesterday. Johns Hopkins reports 352 dead yesterday. 352 is a startling number. It pales in the 200,000, but that's a number that's trending down. The New York Times is reporting 421 dead yesterday. Right, 2 planefuls of people dead yesterday from COVID-19. What's interesting and what's also concerning here is that we have not come as a nation to a point where the numbers are down significantly in terms of new cases. They have bobbed up and down, sometimes as low as 40,000, other times approaching 100,000. With those numbers, right now, deaths are a trailing indicator, right? You have to have a case before someone passes away. There's a time period, tends to be about 3 weeks on average, and the epidemiologists are looking at Labor Day weekend as a concerning weekend, because there's much social gathering, and there was much social gathering without wearing masks, people being too close to one another. So we have those numbers. Things have been good in New York. And New York has, after the terrible March, April, May that New York suffered, New York has been in a position for over a month now with a daily positivity rate of less than 1%. On Monday, there were only 2 deaths reported in New York. Those are tragedies for 2 people, 2 families, but only 2 deaths in New York. Those numbers in New York make the disease manageable in New York. The question for all of us in New York is, how long will things remain manageable if the disease continues to lap up against our borders, which is why we see New York every week adjusting the travel advisory. And 5 other states were added today to the travel advisory. No states were taken off the list. But as long as numbers remain low in New York, the means to manage the disease are available to us, which is contact tracing, quarantine, and isolation. But moving past those numbers, let's go to the medical developments. And some of the things are hopeful, some are simply informative, and some are still negative. First, it's becoming more and more evident that this disease is an aerosol transmitted disease, right? This is transmitted through the air. There seems to be less concern about surfaces. That doesn't mean don't clean the counters. That doesn't mean don't wash your hands, right? Keep doing those things. But it is an aerosol transmission, common for COVID-type diseases, such as the common cold and now COVID-19. What does that also mean? It means we're safer outdoors than we are indoors, right? Because outdoors, with a disease that is in the air, there's air currents, right? There's wind. Wind matters in this regard because it keeps you safe. It blows away the germs, right? That's why when we're talking indoors, ventilation is so important. We've seen the governor talk about ventilators, talk in all sorts of circumstances. And those were real impediments to opening up things like malls. It's been an impediment for opening up casinos and gyms, for example. So ventilation is extremely important. It was also a huge issue, especially down in New York City with an older school system. Places with old school buildings needed new ventilation systems. So that's a significant piece that we've seen. There was something yesterday in the last 2 days of hubbub about the Center for Disease Control discussing transmission indoors and the appropriate distance, and some rethinking of what those appropriate distances may be. that new guidance from the CDC was taken down. We'll see what they put back up in a couple of days, whether it's been amended. But at this point, the guidance remains 6 feet of distance is appropriate, indoors and outdoors. Indoors, all the more important. As we're now in late September going into fall, and we move indoors again, right? We may be coming again to an inflection point where we could see some uptick in infections because of the ventilation issue. So let's talk about who's becoming sick and who is dying. Some good news here, but it's a mix, right? More young people are becoming ill. Not a good thing for young people, but more young people are becoming ill, more as a proportion of those who are becoming ill. I don't have detail to give you in terms of why that's the case. My suspicion is, right, and I know more than any of you in the room know about this, is that older people are confining themselves more than younger people are. That certainly seems to be what you can observe simply going out the door, but that seems to be the case. Now, part of the good news with younger people becoming ill is that younger people are less susceptible to dying from coronavirus. This number has been very steady for months now. 95% of deaths in the United States from coronavirus have been among people 50 and older. Why are younger people less likely to become ill? Younger people have fewer comorbidities, right? Younger people are healthier. The older you are, the more likely the disease is fatal. The fatality numbers among those above 85 are simply astronomical. But it's a question of comorbidities. More than 50% of the people who have died in New York from coronavirus have had hypertension. There's a couple of other numbers I thought were interesting on that. More than 1/3 have diabetes, and over 20% had hyperlipidemia, right? So those are significant numbers, and those things are being tracked by the state health department, by the CDC, and others. So those comorbidities, right? You are much less likely to see obesity or hypertension or diabetes in younger people, but you see it, you do, and there are people who are younger and who are quite ill. That's one of the negative developments that has occurred. While the number of young people who die is relatively small, the medical researchers are seeing more instances in young people who have more serious illness. And that's something that may trail people. I'll talk a bit about that again in a bit later. So let me move to some good news. Treatments are improving. Keep in mind, we've only had this disease identified in the United States since January. With our first cases, I believe January 28th was the first case in the United States. So 7 months of analysis, maybe 10 months of analysis worldwide when you trace back to first identifications in Wuhan, China, right? So there's improvements in how physicians are dealing with people who are ill. One of the things, and you may remember back in March and April when we heard Governor Cuomo talking about, I need ventilators had to be built. We have to have this number of ventilators for individuals. The use of ventilators is being delayed. Physicians are finding the longer you can keep someone off a ventilator, the more likely you are to have a good outcome. Some very simple things like patients who are being ventilated are put on their stomachs instead of their backs. They've had better outcomes with that. There have been some helpful medications that have been identified. And that's something that's very interesting because there's no medication at this point that has been identified as a miracle cure or a silver bullet. But the developments look more typical for major diseases. So what we may see is incremental improvements as a medication is identified, and it may be helpful, and it may eliminate one symptom, or it may increase the likelihood of simply delay someone becoming more ill or even dying. And so what we may see, and it appears so far this is the way the therapeutics are going, that there will be a mix of drugs that will be identified to treat COVID-19. And some of the early drugs identified may be dropped from the list as other drugs are identified that become identified as more effective. And this is true. You see this in a lot of illnesses. People with various cancers are treated by more than one drug. People with Parkinson's disease are treated with more than one drug. And HIV/AIDS, right? Something I was involved in years ago as we were in government trying to address these issues of how to deal with the AIDS epidemic at the time. We used to talk about the AIDS cocktail, which was people with HIV/AIDS had to take a number of drugs. Well, they still have to take a number of drugs, and no silver bullet has come forward for them. And that may be what we see with COVID-19. So that's at least some good news, though. The therapeutics are improving, so the physicians have a better idea what to do, and they've got more tools at their disposal. Let me swing back now, keeping you bouncing up and down here. Some bad news. Becoming clearer to scientists in the medical community that asymptomatic carriers are a real risk, right? There are a number of people, many people, right, who become COVID-19 positive but do not display any symptoms. Those individuals, though, can transmit the disease. And that's a problem. Now, they may not transmit the disease in a virus load that makes as many people ill as somebody who is acutely ill with COVID-19, but that's still being worked out. They still don't know how far that goes or what the range of issues are there. More instances of reinfection are being noticed, and that's very significant because there was some discussion, especially in the early days, that you may, if you get this disease once, you might be good. You may not have to face it again. Then the question started to become, well, how long are you immune? Well, they don't know that yet, but they have found instances of reinfection. We get colds more than once in our life, right? So and this is, and colds are a COVID illness. So we'll see what happens there. The other thing I want to talk about is people who are now being identified as long haulers. Don't know how that term came up, but these are individuals who don't die from the disease, but who are ill for a long time. Now, we've got 7 months under our belt here, so I don't know how long people will be ill, but there are a number of people who are ill for a very long period of time. And what's also unknown at this point is whether the disease will have caused lasting conditions for some folks. I've seen quite a bit, and I've read quite a bit that suggests that there will be a number of people who have this disease trail them for years. One of the mantras that we've heard some people say is, I don't care if I get sick because I'll get better from this disease. Well, what I've seen many physicians say at this point is we just don't know that to be true. Now let's swing back to some good news. Vaccines. We've got very good news on that front, though we have a badly named process. Project Warp Speed is the name that's been given at the federal level to the vaccine development. This is very positive because the vaccine development is moving very quickly. And I've seen a number of physicians, in fact, I've seen a number of physicians who I've followed over the months who appear to me to be very cautious individuals who feel very comfortable with the process that's happening now in terms of vaccine development. The reason they feel so confident about what's happening is about 10 years ago, an effort was begun to put together a platform to speed the development of vaccines. We've heard over and over about that no vaccine had come to market in sooner than 4 years period of time. Well, what we found instead, and what's developed, is a new platform has developed that has been developed, and this development took place over the last 10 years to speed the development of vaccines. Vaccines had been developed, like many drugs, on a sequential basis. So there was essentially a 4-step process. Well, the work was done to see if the sequential process could be reconfigured essentially so that things didn't have to happen in a sequential process, but they started to develop markers to measure against. And that's what's being used now. And from everything I've seen from the reports and from physicians I've listened to and listened to in detail, the process is working and working well. The fear among the scientists and medical professionals in this regard is that politics will interfere, such as the discussions about having something in place by November 3rd, Election Day. Well, that's obviously an arbitrary deadline. It serves political interests, but that also can undermine public faith in whether this vaccine will be safe and effective if it's simply working up against an arbitrary deadline. But left to its own devices, the public health authorities believe that there will be a vaccine and maybe one available in the near term, which could be by the end of the year, could be a little after, could be a little bit before. So what does that mean, having a vaccine available? The best quote I've seen on this is, a vaccine is nothing until it becomes a vaccination, right? You need a vaccine that people will accept, the public will accept. The other thing that's interesting is in terms of effectiveness, vaccines are typically regarded as effective if they are at least 50% successful in reducing the incidence of an individual becoming ill. Well, and that's actually pretty typical for flu vaccines, that the flu vaccines are about 50% effective on average. I shouldn't say on average, let's take that back. But keep in mind, this is not a flu, right? COVID-19 is something different. But if it hits that marker of 50%, you then have the next question of how many people will take the vaccine. Well, if 50% of the country is willing to take the vaccine and the vaccine is 50% effective, that means 25% of the population will be protected from the vaccine. We'll still have 75% of the people who will be left to their own devices. Maybe they've had the illness already, or maybe they can simply avoid people, but that's it. But that's still a huge improvement if we have 25% of the population, right? There's some discussion that New York City may be close to herd immunity because so much of the population of New York City was actually exposed and had either was ill or was asymptomatic or simply appears to have antibodies that make them resistant. So where do we go for the vaccine? Well, then, apart from that basic equation of what's its effectiveness level and what part of the population takes the vaccine, you have distribution time. And how difficult is it to distribute the vaccine, right? You have to vaccinate people, right? And that doesn't happen overnight. We can't all simply have a pill delivered to our homes and we'll be vaccinated. The two of the leading candidates for the vaccine require sub-zero maintenance of the vaccine. One of them requires, one of the leading candidates has to be maintained at 70 degrees below zero. It's a very difficult temperature to maintain. So the distribution will be difficult. There will be many hurdles to overcome. It will also require coordination between federal, state, local, and manufacturers. Protocols have to be developed in terms of who gets vaccinated. Likely, essential healthcare workers will be vaccinated first. Then maybe essential workers, then population groups most at risk, or maybe essential workers and population groups most at risk will be reversed, I don't know, and then everybody else. So that takes time, but there's some process there. There's also a question of dosage. At least one of the leading candidates for vaccines at this point requires 2 doses before someone would be considered immune. So where does that leave us? We'll have some improvements with vaccines, assuming these vaccines cross the finish line. We still don't know if they will, but assuming they will, what else needs to be done? We all need to be pulling the oars in the same direction, right? Masks are going to continue to be required. Social distancing is going to continue to be required for the foreseeable future. There may be new developments in testing because testing is important, especially when we still have isolation and quarantine. Testing seems to be, at least some sorts of screen testing seem to be developed that are cheaper and quicker to use. How long are we going to be doing this? My best guess is still through all of next year. Will there be some adjustments? I would expect so. We can't continue on in the process of simply shutting things down. But right now, we've seen things go both ways. In the South and the West, we've seen things open and close. Great Britain's just this past week announced it's limiting functions to 6 people, right? They had a very terrible time. They reopened. Now they've swung the other way. So we've got a long road ahead of us. We've got a lot of interesting developments. We've got some real good news, some not so good news. But the best things we can continue to do for one another is continue to stay distant, continue to wear masks. Pete, that concludes my presentation.
Thanks, Hermes. There was one question. I think you answered it. When will the CDC put up, the final guidance? And I don't think we know that, or not final, but the guidance that was taken down. When will it be, sort of revised and reposted?
Yeah, we don't know that at all.
Okay. Let's turn to Kate McClung. Kate is in our Rochester office, and she's going to talk about employment litigation, some claims to watch for.
Thanks, Pete. So if we're going to be traveling down this long road, as Hermes put it together, at least we can try to not be sued while we're traveling along that road. So I'm going to talk about some types of COVID-19 claims to look out for, to make sure that you're protected against. We've already seen employees start filing these claims, so they're certainly not waiting around. And there's a number of categories. So first, a lot of companies did layoffs or furloughs and then returned employees to work. Some common areas of concern there are compliance with the WARN Act. There's the Federal WARN Act. There's the New York State WARN Act. They have slightly different requirements, but they both, in general, require that you give employees a certain amount of notice before you lay them off for a certain amount of time. In the beginning, when a lot of companies were shutting down, many to comply with the governor's executive orders, we didn't know how long that the employees were going to be out for. And so some companies ended up hitting that length of time under the WARN Act, the 6 months, but they didn't give the WARN Act notices up front. Another area of concern is both when you're laying off or furloughing, as well as when you're returning people back to work, how are you making those decisions? What methodology are you using? Are you doing it based on seniority? Are you doing it based on performance? What you can't do is you can't do it based on protected categories. So you can't lay off your older workers. You can't return your workers who don't have young children back to work first because you don't anticipate them needing leave. So be careful in making those decisions that you have legitimate grounds to defend how you made the decisions and what methodology you used. We're also seeing a lot of employees asking for reasonable accommodations. One type of accommodation we're seeing a lot of is the ability to work remotely because the employee is at high risk for COVID-19. Sometimes that request is coupled with a request for the employer to provide certain technology to enable the employee to do their job remotely, a printer, a scanner, a mobile hotspot, these sorts of things. Also, some employees are requesting additional protections in the workplace. Hermes mentioned that filtration systems is something that certain employers have looked into improving because there's increasing concern that this is an aerolized virus and that it's not just spread within a 6-feet radius. So some employees have requested, a standalone air purifier in their office or things like that. Other employees have asked for a higher level of PPE or a different type of PPE. So for example, an employee doesn't want to wear a face covering, but they would wear a face shield. Also changes to the workspace. I don't want to work in a cubicle because I'm too close to people around me. I'd rather work in an office with the door closed. As an accommodation, please move me to an office instead. So those are some common types of things. And remember, it remains very important to engage in that interactive process, to document, to get documentation from the employee about their accommodation. And if the documentation you get is insufficient, you can push back and you can ask for the documentation that has all the information that you're entitled to in making that decision. A lot of wage and hour concerns with COVID-19. So when your non-exempt employees are working remotely, are you really compensating them for all hours worked? How are you tracking their time worked when they're remote? Are they getting meal breaks when they're working remotely? How are you documenting that? If they're incurring business expenses that you're not reimbursing them for, are those business expenses bringing them below minimum wage? If an employee has to buy with their own money that printer, that scanner to work remotely, if that brings them below minimum wage, that can be a claim. For when you're doing furloughs, remember exempt employees, any week they perform any work, if they're subject to an exemption with the salary level requirement, they have to be paid their full salary for weeks when they perform any work, subject to very narrow exceptions. A lot of employers have been dealing with that by furloughing exempt employees for full weeks. You know, the first full week of every month, you're not going to work. What precautions are you taking to make sure that they're not working? Are you instructing them not to perform any work? And if you find out they have been working during that week, are you paying them their full salary? Remember, if you find out they were working, you have to pay them. You can discipline them for violating the rules that you put in place, but they do need to be paid for weeks that they're performing work to meet that salary level requirement in the exemption. Some employers have been offering additional payments to employees, such as hazard pay, non-discretionary bonuses. You know, it's important to keep in mind as you introduce new forms of compensation for your non-exempt employees, those additional payments may go into the regular rate calculation for overtime purposes. The regular rate is not just the straight hourly rate you pay them. If you pay them a non-discretionary bonus, for example, that needs to be included as well. So make sure that you're not creating a huge source of liability by being generous and giving your employees new forms of compensation. An increasing number of employees have to do pre or post-shift sanitation or hygiene protocols, as well as screening time before their shift. And so there's questions about whether or not that's compensable time. There is a helpful Supreme Court precedent that weighs against screening time at least being compensable, but this issue is very fact specific and is really going to be determined employer by employer, and the answers can vary by employers. So again, that's an area of potential risk as well. Okay, COVID-19 leave laws. We have the Families First Coronavirus Response Act at the federal level, and we have the New York COVID-19 leave at the state level. Those obviously create some concerns as well. So if you fail to provide the leave, that's obviously an area of concern. But there are other concerns, other legal risks as well, even if you provide the leave. There's rules about how to calculate regular rate. Regular rate varies a lot for many employees week to week, and you need to look back at an average over a certain period of time. So make sure you're using the right regular rate to pay it out. Also, how many hours are you paying them for? You can't just say 40 hours per week for all your employees. There's very specific rules in the U.S. Department of Labor guidance about how many hours per week you need to pay out under the federal law. You need to look at their normal schedule. If they don't have one, you need to look at their average hours worked over 6 months. If they haven't been there for 6 months, you need to look at whether there was an agreement upon employment about how many hours they would work. If there's no such agreement, then you need to look at the average hours worked throughout their employment. So, you know, a complicated set of rules, easy to goof up, but make sure that you are calculating them for all the hours worked. Also, there's non-retaliation provisions, and those can lead to lawsuits if you take adverse action against an employee for taking leave under those statutes. It's important to remember there's other leave laws as well. You know, with these new leave laws this year, it's easy to get distracted by them and lose sight of some of the traditional leave rules that we've always had. But make sure whenever an employee needs time off, you're considering all their options and that you're complying with the rules under all of these statutes, the notice provisions under all of the statutes, and you're not opening yourself up to liability here. Finally, some other types of claims. If you are inconsistent in your practices or your enforcement of your policies, that can open you up for a discrimination claim. So for example, if your employees have exhausted or aren't eligible for leave because their kids are out of school, are you making it easier for moms to get unpaid personal leave of the absence under your policy than you are for dads? That could open you up to a sex discrimination claim, for example. So make sure you're being consistent in how you're treating your employees. There's also potential for whistleblower claims. There's a lot of new rules, a lot of new requirements. I've heard a lot of anecdotal stories about employees complaining about new policies at work, either that they're too onerous or they're not sufficient. If employees are complaining that you're not complying with the law, you want to be careful and make sure you're not opening yourself up to any sort of whistleblower claim. Also, breach of contract if you're not complying with the terms in an employment agreement or with your employment policies. If you make temporary changes because of COVID, keep in mind that to the extent your handbook constitutes a contract, that can open you up to breach of contract claims as well. So the takeaway from all this, if anything I've said concerns you and makes you think, oh, am I really doing this right? Check now. Don't wait for a lawsuit. There's things that you can take to protect yourself against a lawsuit, or at least minimize that legal risk if you catch it early. That's all I have, Pete. Thanks, everyone.
Well, that's all, Kate, but that's a lot. You covered a lot of ground there. Thank you for that. Let's turn to Adam, and Adam's going to take a little different tact on this. I think Kate covered, a lot of the employment theories. So Adam's got a couple of additional thoughts on potential liability for employers related to the COVID pandemic.
Thanks, Pete, and thanks again for having me. Kate did a really nice job of going over an employer's potential exposure when we think of traditional employment laws. There are other areas of potential business exposure as well related to COVID, and I want to touch on those, like Pete said. So first of all, we think of lawsuit liability, and that's what Kate was talking about. Employers want to take steps to protect against lawsuits and or claims with administrative agencies that relate to employment laws. There's also lawsuit liability for failure to provide adequate protections at work. And these are some of the claims we've seen that have already been filed. These have been the claims that have been predominantly filed to date. You'll have an employee who files a claim against a lawsuit or against their employer, claiming that the employer didn't provide adequate PPE, didn't adequately clean their facility, didn't enforce social distancing guidelines, et cetera. These are called conditions of employment lawsuits. And we've talked quite a bit about these lawsuits in these webinars. What I'd like to do is kind of give everyone an update about where those claims are, what the defenses are, and what we're seeing currently. So one of the best examples of these claims is a lawsuit that was filed back in April in the Southern District of New York by a group of nurses against a traveling nursing company. The group of nurses claimed that they're making a number of claims, but one of the claims is that they weren't provided adequate PPE. They were placed in situations that were unsafe because of the COVID pandemic. Where that case is right now, as is the same for many of these cases that were filed in April, May, and June, is they're in the discovery process. So what we're seeing is that the parties in these lawsuits are starting to exchange information with one another. These information exchange exercises include producing copies of policies, producing copies of verification that policies were being followed. So I think they're helpful for businesses that are concerned about this type of liability. They're helpful to show what you're going to need to have in the event that a claim is brought against you. So you're definitely going to want to make sure that you have your policies in place that are in place. You're going to want to know what process you undertook to develop those policies. You want to make sure that you have information or documentation that those policies are being followed. So for example, if you have a screening policy, you want to make sure you know when that screening policy took effect, what questions you've been asking, and you want to make sure to know that your employees who are coming to in-person work have passed the screening. So I think that these cases and where they are right now help businesses to understand what they're going to need to have on hand in case a claim is made. Now, the biggest defenses to these types of claims we've covered before. I will briefly go over them. One of the largest defense is the workers' compensation exclusivity defense, and that is that employees who are injured on the job, their sole remedy is to go get comp benefits and not to sue the employer. You're also going to have the defense of assumption of risk and or contributory negligence for these employees. You assume the risk of coming to work, and or you did some other act, or you engaged in some other conduct which was more likely to give you the virus. You'll also have at your disposal the defense that these claims are so difficult to prove. So employees are going to have to show not only that you did something wrong, but also that they caught the virus while they were at work. So you have a number of defenses available to you. My point in bringing up that litigation was to kind of highlight what we know now employers are going to have to prove that they were in compliance with state and federal regulations. In addition to lawsuit liability, businesses are also subject to potential liability from governmental regulatory agencies. So for example, we know that the New York State Department of Health has been pushing all along, as part of the reopening process, complaints. So New York State has made it very easy for employees and or patrons to make complaints about businesses. And the complaints range from they don't have a policy in place to they're not implementing the policy that they have in place. So we've seen businesses get contacted by the Attorney General's office, and the Attorney General's office will commence an investigation, make sure you have your plans in place, make sure you're implementing your plans, and make sure that your workplaces and or businesses are safe according to the Department of Health standards. So that's one, on the state level, that's the administrative agency where you might see questions and or investigations. We also know that OSHA has been investigating certain employers. And recently, last week in fact, OSHA issued some pretty hefty fines to food processing companies, not in New York State, but one in South Dakota and one in Colorado. The fines were between $14,000 and $16,000. And it's interesting because these are the first wave of fines that OSHA has started levying as a result of failing to follow COVID safety precautions. Now, these fines were issued in the most extreme cases. I should point that out. One of these food processing centers had 1,300 cases and 4 deaths. So you'd think that a company that had that much, or a business that had that prevalent of an outbreak, probably was doing something wrong. So we know that OSHA, is investigating these types of claims. In New York, obviously, the best defense against any regulatory claim, against any lawsuit, is that you have a plan that's in place that satisfies and follows the guidance put forth by the Department of Health and by federal agencies as well. OSHA has some industry-specific guidance, so if you are concerned about whether or not you're following the appropriate guidance, you can also not only check the New York State Department of Health website, but you can also look on OSHA's website to see if there's any industry-specific guidance for your industry. Interestingly, we've worked with a number of clients on these issues, and when OSHA comes knocking, they're looking for the same types of information that you'd find in discovery in a lawsuit. So OSHA's asked for things like lists of employees who have tested positive within a prescribed time period. They've asked for specific plans. They've asked for visitor sign-in sheets. They've asked for risk assessment results. So if you remember early on in the process, what we and what the state was telling all businesses to do is make sure you're performing a risk analysis. Where are your employees and or patrons most at risk? So OSHA's been asking, what risk assessment did you perform, and tell us and show us how that assessment was performed and the results of it. OSHA's also been asking about whether or not risk assessments were shared with employees, what communications go to employees. And so we know that OSHA has been asking for the same type of information that you're going to need if in the unfortunate event you get sued. So I guess the moral of the story is, for my portion here, document everything, make sure you have proof that you are complying with state regulations, federal regulations, And at this point, after we've been going for several months, most businesses have been open for several months now. Make sure that your business is following your plan. I think that's the next stage here is, are you following the plan that you put in place? So Pete, that wraps it up for me. I don't have anything else.
Yeah, I think that's right. I mean, everyone's got some degree of COVID fatigue, right? And I think we just need to steel ourselves to, be disciplined and follow our plans and make sure that, we're doing the best we can. Not following your plan is going to lead to problems. So let's turn to Mallory. Mallory, we keep getting, every week we get people asking about unemployment, and we've done several presentations on it, but I had asked you to just summarize today where we are. So if you could please give us a few minutes.
Yeah, thanks, Pete. So I'm going to give a little update on what's going on in unemployment. Just a little bit of background. As y'all may remember, the CARES Act, which was enacted back in March, provided enhanced unemployment benefits, and this included expanded coverage to people not normally covered by unemployment, such as independent contractors. It provided for an additional 13 weeks of unemployment benefits for up to 39 weeks. For those two benefits, this expires at the end of the year, and actually December 27 to be exact in New York. The CARES Act also provided for an additional $600 per week in benefits, and this benefit has already expired. It expired at the end of July. So since that $600 expired, President Trump signed an executive order which provides not $600, but instead an additional $300 per week in unemployment benefits to claimants. This program is known as Lost Wages Assistance and is funded through FEMA's Disaster Relief Fund. The additional $300 is available to any claimant, regardless of if they qualify for the regular unemployment or if they qualify for unemployment under the expanded coverage. An important note about this program is that in order to be eligible, a claimant must have a weekly benefit rate of at least $100 to be eligible for the additional $300. The $100 cutoff is based on a claimant's benefit base rate, which is calculated before any deductions or reductions. So in New York, the minimum weekly benefit rate under regular unemployment is $104 per week. Under the expanded coverage, the minimum weekly benefit rate is $182. So even if a claimant receives less than $100 from the state because of either taxes or part-time work or some other reduction, they still may be eligible for that additional $300. Recently, on September 18, the New York DOL announced that it had released $1.9 billion in funds to cover the additional $300 per week for the weeks of August 2nd, August 9th, and August 16th. So claimants should have received that money for those 3 weeks by now. The next day on September 19, FEMA approved New York for a second and final round of lost wages assistance funding. This funding covers 3 additional weeks of the extra $300 benefits. So it will cover the weeks of August 23rd, August 30th, and September 6th. Claimants should receive this money by the end of this week, so September 25. FEMA has exhausted funding for this program, so it will not continue after the week of September 6th. At this time, we don't know if claimants will receive additional unemployment for weeks after September 6th, but we'll keep monitoring this and keep everyone updated. Another update is crucial for self-insured nonprofits. Under the CARES Act, self-insured nonprofits are entitled to reimbursement from the federal government for 50% of the amount that they would normally have to pay to the state. So initially when this came out, we weren't sure, there were 2 options at play. So first, either states could charge 100% to nonprofits and then later reimburse 50% to the nonprofit after receiving the federal reimbursement. The other option is that states could only charge nonprofits 50%, and then the state would wait to receive the other 50% from the federal government. Every state, including New York, chose the first option to charge nonprofits 100% and then wait for the 50% federal reimbursement. On August 3rd, President Trump signed into law the Protecting Nonprofits from Catastrophic Cash Flow Strain Act. This act explains that states can only charge nonprofits 50%, then must wait to get the other 50% from the federal government later. So this is not applied retroactively. So for previously applied charges, nonprofits can be charged 100%, but from August 3rd forward, self-insured nonprofits should only be charged 50%. If you're a self-insured nonprofit and you're still being charged 100%, we do not recommend to just ignore the charge and pay the 50%, pay half of it. We recommend that you reach out to the Department of Labor, explain the situation, what's going on. And I know that we have helped several clients through this process with the Department of Labor, and we have not been turned down yet for only paying the 50%. One last quick update on unemployment. Governor Cuomo issued an executive order on September 18. Part of this executive order excludes per diem part-time work performed between September 18 and November 3rd for either the New York State Board of Election or local board of elections, as long as the earnings do not exceed $504. And that's all the updates I have on unemployment, and we'll keep you updated, and I'll hand it back to Pete.
Thank you, Mallory. Good to just, kind of keep everything straight there. We're going to turn to Kate Schimmelwick now. Kate has, we thought it would be helpful just to kind of recap where we are with the relief programs, things for people to keep on their radar. So we've got a few minutes on that to take us home today. Kate, take it away.
Thanks, Pete. It's great to be back providing today's update on the relief programs available to our clients and other businesses. So first, I want to start with the Main Street Lending Program. So the Main Street Lending Program got up and running far later than the PPP program and has different requirements than the PPP did. As of right now, the Main Street program is up and running for nonprofits. So that is a new update that is good to see. It is not up and running for non-nonprofits as of right now, or I should say for-profit businesses. So now turning to the PPP, there has not been guidance issued by the SBA formally in weeks. So right now, all of the current rules that we've previously talked about are still in play. There was, of course, the legislation that's worked its way through Congress that has stalled. The most recent legislation that stalled in Congress had a lot of changes to the PPP that we've previously talked about. But once again, that's stalled. That has not gone anywhere. That's not in play. So things like lighting documentation, second rounds of lending, all of those things are not active yet. And we, quite frankly, right now don't know if any type of relief package related specifically to PPP will get passed in the coming months. So we know that the House has made it very clear that they are not looking to do a piecemeal type package. So I know we've received questions asking if there will maybe be something passed that's very limited to the PPP. And at this point, like I said, the word that we've received publicly from the House is that they're not looking to do a piecemeal package. So right now, I think borrowers need to rely on the rules as they stand that have been issued by the SBA and the past legislation that Congress has previously passed. So where does that bring us? I've had a lot of clients call asking about what they should be doing. They're not quite ready to apply for forgiveness, or their lender isn't. So I wanted to provide a quick update on really those things that borrowers should be thinking about. So as of right now, it's our understanding that most lenders are still not accepting applications. There's been talk that some lenders were thinking about starting back in August last month, and that those dates have seemingly been pushed out. So we'll see what happens there. So when borrowers may be ready, your lender may not be. So first off, you want to be in good communication with your lender. Whoever you have the relationship with, your banker, have that conversation. Ask them where they are in the process, if they're even accepting applications yet. Keep in mind your lender's the first set of eyes on that application, who is going to issue the approval to the SBA and the approval amount of your forgiveness amount. So keep that in mind. You want to be having those conversations with your lender. Next, This is the thing that everybody knows that I've talked about on many of these webinars. You want to make sure your documentation is put into a file and is ready to go in tight. That way you're able to provide that documentation and not be scrambling later if somebody at the bank or at the SBA asks you to go and provide that evidence of, you know, the FTE exceptions that you're claiming or anything like that. So you want to make sure your documentation is ready to go. Now is the time, if you can't apply yet, to go and make sure that your documentation looks good and is ready to go. Next, right now you want to be really thinking about ways to maximize your loan forgiveness amount. So as everybody here has heard me say many times, there is exceptions to rely on when you have loan forgiveness calculations to make. So of course there is loan forgiveness for reductions in salaries, and there's loan forgiveness reductions based on FTE reductions. So for your FTEs, what can you do? What are your exceptions? So keep in mind, you've got, if you furloughed people prior to April 26, 2020, and you bring them back before December 31, you can rely on, that's one exception. And remember, it's an all or nothing, you gotta bring everybody back. If you have employees who refuse to come back, you have certain exceptions that you can rely on in that situation. If particularly if you try bringing someone back, they refuse, and you have documentation. Again, here we go, documentation to document your attempts to rehire someone else who is similarly qualified, right? Another exception to think about is employees who have retired, who have been terminated for cause or have quit voluntarily. That is something else that you can rely on. The last FTE exception that we're going to talk about is, of course, related to businesses that were unable to operate at the same level of business. So keep in mind, this exception is for borrowers or employers who in good faith are able to document an inability to return to the same level of business activity as the business was operating at prior to February 15th, 2020, due to compliance with requirements established or guidance issued by the Secretary of Health and Human Services, the Director of the CDC, or OSHA, beginning on March 1 through December 31. And then keep in mind, this was expanded to then cover local and state orders. And again, this is all related to the maintenance of standards for sanitation, social distancing, and worker or customer safety. So the SBA has indicated that they expect many borrowers to rely heavily on this exception for the FTEs. So keep in mind that if you're going to rely on this exception, again, with documentation, you're going to want your copies of the relevant government orders, copies of the applicable requirements for your locations. So, you know, when we're talking about occupancy, you want to know what your occupancy was and what the executive order was that says that you can only operate at a certain capacity. And then, of course, your financial records. So when we talk about the executive orders, again, keep in mind, there's been over 60 that have been released since the beginning of the pandemic on this issue. Many of them that borrowers are going to start thinking about to use relate to the closures of the businesses, the reductions in the workforce, first at 50%, then 75%, and then 100% for non-essential businesses. So you're going to want to know those executive order numbers and have copies of those. If you have specific industry guidance to your applicable industry where you were able to open but you weren't able to perform all services, something like hair salons is a good example of that. You're going to want to know the actual industry guidance as well. Schools is another situation where there's specific industry guidance on top of the general executive orders. And then, of course, you're going to want to know your phase. Everybody has to keep in mind, you know, Buffalo, Syracuse, New York City, all opened at different times. They're in different we're able to move into different phases at different times. So you're going to want to make sure that you have all of your executive orders in ready to go in order to go and rely on this exception when you're asked to go and provide the documentation. And of course, these are things that we're of course able to help with if you're having trouble trying to figure out what executive order applied. These are all things that you contact one of the attorneys that you normally work with in order to go and talk through and figure out what executive order or executive orders work best for your business to rely on this particular FTE exception. All right, that's my update for today.
Kate, thank you. And thanks everybody for hanging in with us. We ran a little long today, but a lot of material to cover. So everyone stay safe out there, and we'll talk to you next week.